A machine that sucks in air and tested for COVID is being tested at Teesside Airport. If the trials are successful, airborne pathogen detection machines could be used in places where there are a lot of people, like airports, hospitals and retail outlets. Our correspondent Fraser Maud is at Teesside Airport for us. Fraser, just tell us how this is working.
Well, this is the machine itself. It's cost over £1 million to develop, with money provided, funding provided by the government through UK innovation. And it really is an incredibly clever piece of kit. It's sucking the air in, as you say, circulating that, testing the air molecules, testing for pathogens, and in theory and in practice here at the moment during this trial run, it's detecting any indication that there is COVID in the air. It's a very, very clever piece of kit. It's been developed by Kromek, a company that are based in Sedgefield, just down the road here, so great news for the local economy as well. Their CEO is Dr. Arnab Basu, joins me now. So just tell us, how does it work, Doctor?
This is a all-in-one airborne COVID-19 detection system. It collects a large volume of air, ideally suited for large indoor spaces like an airport lobby, and converts that air into a droplet of water. So it filters out all the particles such as dust or skin cells that hangs around in air, and really concentrates just the viruses or the pathogenic particle into a droplet of water. And that is then taken through a biological protocol and analyzes that for the presence or absence of COVID-19. A very accurate way of analyzing it, and then it reports.
I was just going to ask, how accurate is it? I mean, what are the sort of levels of COVID that would be needed to be identified by this?
This has been tested extensively in labs, the protocol that we use, and it is really as sensitive as almost a PCR system. So we can detect very, very low levels of COVID in air.
And in terms of the practical applications, obviously it's being trialled here at Teesside International Airport. It's also been trialled in a local primary school. What are the practical applications? What could we have done differently had this technology been available to us a year or more ago?
Look, in Kromek, we believe that earlier you can detect something, you can take mitigating actions. So whether in our other parts of the business in radiation detection or in this, really knowing what is there in air, whether COVID is there in the air, gives us an ability to really react, whether to decontaminate the place, whether to isolate certain people, whether to do more targeted testing, and really keep everybody safe ultimately.
And if we look back at over a year ago when people were criticising the government for not closing borders sooner and so on, I guess this would have been a pretty vital tool back then to know when and how quickly and where to close certain access routes and so on to avoid viruses getting into the country in the first place.
Look, this is a near real-time information system. So having that quality of information in very short periods of time would have provided another tool for the government and the regulatory authorities to really take mitigating action, which could have been different. But we are now here where we are able to provide that clarity of information to a range of settings, such as schools, such as airports, maybe in clinical settings, but also in other public settings, such as theatres probably, and event settings, where critical decisions can be taken by having the really good quality of information.
And in terms of the technology, it's technology that you were already working on that's been adapted and refined in order to detect COVID. How difficult was it to make that step from detecting the things that you were detecting, which are things like explosives and so on for airport security, into detecting the pathogen that's identifiable as COVID-19?
We started a airborne pathogen detection system back in 2018, way before the pandemic hit us, under a program for the U.S. Department of Defense agency, DARPA, which were looking really to build an early warning system against the threat of bioterrorism. So that started back in 2018, and when the pandemic hit, we started looking at a more specific sort of detection system, which was then funded by Innovate UK, and as a result, we developed the COVID-19 system. The system we are developing under the DARPA program, it will be able to detect every pathogen that is present in the air. It's also this operations, the principle of operation is very similar. It takes a large volume of air and provides the full pathogenic signature of that air using DNA sequencing. which is ideal to be used as an early warning systems against any pathogenic threats.
Dr. Massey, thank you very much for explaining that to us. Complicated stuff, an incredible piece of kit, and one which could have been very, very useful were it around a couple of years ago, but could be vital in the fight against keeping viruses such as COVID-19 out of the country and out of public spaces such as this.
Fraser, thanks very much.